Hey, Mr. Flood, it's good to see you again.
Good seeing you again. Well, one of the things that I realized now with what you have at the Onslow Surgical Clinic is you have trained your people well, okay? And they are very responsive to me. And the meeting I had with you before, you really did put me at ease. It's something that I'm sure most men or women really don't look forward to.
Right.
I mean, it's just something that we wouldn't, but you explained everything in detail to me.
Yeah.
And I felt very comfortable knowing that you were going to do the colonoscopy. I mean, and I've had enough in my life since I've been 50, I've had a few of them, and I've never been treated as well as I have with you and your explanation of everything that you were going to do.
Right.
And then meeting afterwards. But most importantly, that day I woke up, I had to have a 5:30 in the morning appointment. And if you remember that day, it was raining cats and dogs because a lot of nurses were coming in late. But we got here on time, okay? From the very beginning, from the time we walked in, the people that I dealt with were unreal. I couldn't understand how anybody could be that cheery at 5:30 in the morning. And they were more than helpful, but they were just wonderful. But it was one of those days when I thought, why am I doing this? Yeah, I'm going in for a colonoscopy.
Yeah.
And this, everything had happened from the time we walked in. My wife was with me. Everybody was smiling. Everybody was more than helpful. And it's the first time that I can remember we had a room.
Okay.
Normally, the ones I've had remind me like in the Army, where there was just a curtain.
Right, yeah.
You know, so you had different people laying in beds waiting to go in for the colonoscopy.
Right, yeah. Well, we try to treat people like we would want to be treated.
And it really showed.
Yeah.
But it was just the way, the whole operation, how smooth it was. When they gave us a room and they had me all wired up and in bed, the nurses kept coming in. I've been in a lot of great hotels in my life, but I've never been treated as good as I was that day.
Well, I'm glad.
You know, so it's a reflection on you, because I'm sure the nurses and stuff want to do right in your eyes.
They do. Yeah. I think they do right for me, but they also do right for you, because you know, we take care of other people's family members. I mean, I've taken care of nurses, and I've taken care of nurses' family members, and I think that a lot of them try to treat our patients just like they would our family members.
Well, you know, we talked about different things, but I'll never forget, as long as I live, my wife's in the room with me, and she was cold because the rooms are fairly cold. Mm-hmm. I didn't have any problems because they kept bringing me these warm blankets, so I was fine. So this one nurse asked my wife, she says, "Is there anything I could do for you, Mrs. Flood?" And my wife says, "I'm cold." Not only did she bring a blanket to her, one of those warm, I don't know how you heat them up, but one of those warm blankets, she didn't just hand it to my wife. She wrapped it around my wife. And I was laying there thinking, man, this is righteous.
Yeah.
And it really, my wife really appreciated it because she was cold.
Yep.
The other thing I noticed was when the anesthesiologist came in, young man, ex-military, I think he was. He was super. He explained everything that was going on, talked to you. The nurses were in and out constantly. But the thing that really amazed me is when they decided to take me down to the operating room, and they were wheeling me down. I know it's a hospital, and I know it should be clean. I have never seen anything so clean in my life.
Yeah.
I mean, I'm on my back, and the ceiling, the floor, the walls were spotless.
Yeah.
I mean, I know, like I say, it's a hospital and you have a lot of people in and out, but it was amazing. I mean, I just felt comfortable that I was going to be taken care of. And when we got to the operating room, the nurses there were I just get a big kick out of how the nurses were she made sure I was covered.
Yeah.
I'm in for a colonoscopy,
Right.
lady. There's nothing that you probably haven't seen in your
Right.
life. But they were very gentle and very, very caring.
We want you to be warm. We want you to feel comfortable.
Yeah, and it exactly was, I don't think, by the way, I had to count from 100 down. I don't think I got more than 99. And I was out like a light.
Yeah. Yeah. Well, our team is very professional. They know what they're doing. We've been doing it for a long time.
Well, it really shows, because when I woke up, I was in the room, back in the room, and like I said, they even had my wife wait in the room, so she was there when I woke up. And even again, the constant, nurses coming in, are you okay? How do you feel? And it was like, I can't believe this is all over, it's done.
Mm-hmm.
But then when I met with you later, and you said, well, we'll see you in 5 years. My first thought was, oh, no, you won't. But the more I thought about it, I thought, I don't have a problem going.
Yeah.
The worst thing of a colonoscopy, and everybody tells you this, I'm sure, is the day before.
Yep. Yep.
Once you get through the day before, but the whole service, like I say, is probably the most professional group of people I've been around.
It really means the world to me that you have had not only a good experience with the clinic, but also with the hospital in having your procedure. And it really, it's really important for physicians to hear back from patients to know that what we're doing is actually making a difference in your life, right? So, you need to come back and have your colonoscopies. The fact that you're willing to do that and that you now feel like it's important, it really does mean the world to me, and I appreciate that.
Well, I think, if you talk to all your patients, hopefully they'll have the same feelings that I do,
I hope so.
I do too, because all I can say is, if you have any patients that are leery about it, have them call me.
Okay. Will do.
Okay, because you do a great job. I appreciate it.
Yeah.